Hi, my name is Marc Bonaca. I'm a cardiologist and vascular medicine doctor at the University of Colorado in the United States. The THEMIS trial was designed to understand whether potent P2Y12 inhibition with ticagrelor added to aspirin versus aspirin alone would reduce major adverse thrombotic events or atherothrombotic events like MI and stroke in patients with diabetes and atherosclerosis who'd never had a myocardial infarction. And in this analysis, we looked at a subgroup of patients who had concomitant peripheral artery disease or atherosclerosis in the limbs. Well, one of the objectives of THEMIS was really to understand the spectrum of atherothrombotic risk and the benefits of ticagrelor. And so it included prospectively the ascertainment and adjudication of major adverse limb events like acute limb ischemia and major amputation of a vascular etiology. Also, information around revascularization procedures was collected to understand not only the risk profile, but also the potential benefits of ticagrelor. So in the overall THEMIS trial, there's over 19,000 patients with diabetes and coronary disease, but no history of myocardial infarction or stroke. And they were randomized to ticagrelor or placebo on a background of low-dose aspirin and followed through long-term follow-up. This included a subgroup of patients with peripheral artery disease. And although the primary endpoint was the composite of cardiovascular death, MI, or stroke, limb outcomes were also collected and prospectively adjudicated, including acute limb ischemia and major amputation. The key findings in this analysis were first, that patients who have concomitant peripheral artery disease, so remember all of these patients had coronary disease, but also peripheral artery disease, also known as polyvascular disease, in the setting of diabetes were at a very high risk of both major adverse cardiovascular events like MI and stroke, but also limb events, including acute limb ischemia, major amputation, and the need for revascularization procedures on the limbs to restore perfusion. So the first finding really related to the risk profile, and this has been seen in other data sets, that patients with polyvascular disease are very high risk, and specifically PAD for limb risk. Then what we observed was that ticagrelor was beneficial in terms of reducing the risk of major adverse limb events with almost a 50% reduction overall and an even greater absolute benefit in those with peripheral artery disease. I think this is an important analysis for two reasons. One, it really helps us understand the risk profile of these patients. And we know that prior myocardial infarction is a marker of high risk, but these are patients that never had a prior myocardial infarction. So patients with atherosclerosis and polyvascular disease, including PAD, in the context of diabetes are very high risk. That is one key observation. The second is that long-term ticagrelor is now approved in the US for this population. I think it's under review in Europe. But it's beneficial, particularly in the subgroup of patients who'd had a prior PCI. And now I think for patients who have concomitant peripheral artery disease and we're worried about limb outcomes, it may be a reasonable option there as well. Well, I think there's a lot of focus now on peripheral artery disease and different strategies to reduce risk, and a lot of recognition of how bad limb events are and how frequent they are. It's been traditionally underreported, I think, in randomized trials of medical therapies. Now, I think the data from THEMIS also support the data from Pegasus TIMI-54 that there's a limb benefit for ticagrelor. I think what's unknown is what really is the efficacy and safety of such a strategy in a dedicated PAD population, particularly after intervention or revascularization, which is the highest risk period. And here we really don't know what is the efficacy and safety profile of this approach, and we can't really comment from THEMIS, but I think an area for future study. And based on the very encouraging results of the Voyager PAD trial, which shows that a more potent regimen with dual pathway inhibition with rivaroxaban is beneficial and has net benefit in this setting, I think more trials like Voyager PAD are needed to really understand how to best treat this extremely high risk population.